Hi. So I'm going to be focusing this series of videos further into understanding some of the more common types of musculoskeletal pain. In this video, I'll be looking specifically at knee pain. Musculoskeletal conditions itself are the reason for almost 1 out of every 7 GP consultations. So it's a fairly high number. Knee pain by itself is one of the most common musculoskeletal problems. Now, there are many causes for knee pain. Often the thing that springs to our mind is actually arthritis within the knee joint itself. But realistically, it's not that common when you think about the various causes of knee pain. In fact, the study from Versus Arthritis, from their work that they published in 2021-22, suggested that actually 18% of the patients over the age of 45 will have arthritis as a cause of their knee pain. That's about 4.5 million patients with knee osteoarthritis. So quite a significant number. But if you look at only knee pain by itself, then the causes vary. Often in the younger population, there may be, and there is likely to be, soft tissues. As you know, the knee is one of those joints which is not just about the joint between your thigh bone and your sort of tibia, as it were, the leg bone there, but it's also got the kneecap, and it has got the ligaments, your quads muscle, which overlaps onto the joint. And then you've got a lot of ligaments around the knee joint, and then you've got the cartilage within the joint as well, all of which are subject to various forces, and often most knee pains are due to these soft tissue problems with the cartilage, problems with the ligaments, problems with the muscle, or sometimes problems of the kneecap that slips out and in. And these are all conditions that can be significantly managed by good physiotherapy, early physiotherapy, sometimes intensive physiotherapy, and the use of other mind-body techniques. When it comes to arthritis, that is proven either by an X-ray or clinical examination combined with investigations. That would be the place where the traditional role of injections like steroid injections. These days there is talk about regenerative therapy injections also making a difference. But this is something that you would have to discuss with your specialist to understand when it is the right time to go for that and when would be the right time to pursue something even more dramatic like knee surgery. We know that the evidence for surgeries like washout of the knee do not have much long-term value. In fact, a study was published a few years ago where they compared a group of patients who had a washout of the knee and another group of patients who were blinded, like they weren't told that they were having a washout, but they were given a general anesthetic. They had a couple of cuts on the skin to make it look like they might have had a washout, and then that group of people, both groups of people actually underwent a physiotherapy program afterwards. And 2 years later, when they looked and saw how many people had returned to work, how many people had less pain, how many people were using less pain medication, they found no difference between the groups that was clinically significant, which meant that knee washout surgeries are not really, neither are they good value for money, nor are they clinically effective when compared to a good physiotherapy and rehabilitation program. So it's really a question of what are the things you can do to manage knee pain. And once you've had the exploration and investigation to make sure that the soft tissue problems are managed best with good rehabilitation, the management of knee arthritis itself does require the use of sometimes medications, sometimes really looking at weight management, because there's studies to actually say that people who are obese, who have got a higher than normal weight, are 2 times at risk of having arthritis. So realistically, even trying to reduce weight or looking at other lifestyle measures such as sleep, as well as medication optimization, exercise pattern, again, we have evidence to say that with exercise, you're likely to get up to 10 to 15% reduction in your knee pain. So if you can bring all these conservative measures, if you're able to bring these self-care abilities into your knee pain management, then that means you can safely extend the knee that you have before you have to go in for anything more surgical or irreversible options as an operation. At that time, it would be the right place to discuss with your surgeon the benefits of such a surgery, the risks of such a surgery, what are the alternatives to surgery if that's required, and of course the most important question, what if you did nothing? And I think it's very important that those discussions are had at the right time. But until then, focus on the mindset, which is medications, appropriate interventions, the understanding of the reasons for pain, any dietary interventions you can do, sleep optimization, exercise and physical activity, and therapies of the mind and body. I hope this video is useful and informative. Thank you for listening to this video. I'll see you in the next one. Thank you for watching this video. I hope you found the content useful and of value to you. Please don't forget to subscribe to my channel and hit the like button for more videos to be notified.